Our view of what a heroin addict or somebody who's suffering from heroin addiction looks like has changed quite a bit over the years. And heroin is much more involved in today's society than it once was. And what I mean by that is heroin used to be a very taboo topic, drug. Maybe not a lot of people knew somebody who was suffering from heroin addiction, but now we're starting to realize it could be a family member, a friend. Due to the opioid epidemic, we're seeing a lot more heroin. So what is heroin? Heroin is an opioid drug that's been extracted from the opium poppy plant. It also is classified as a Schedule I narcotic. What that means is there is absolutely no recognized medical value and it's highly abusable. So why is heroin so addictive? When somebody ingests heroin, there is a surplus of dopamine. And dopamine will, of course, create a euphoric state. But dopamine is also used as a learning neurotransmitter. So when somebody ingests heroin, what happens is the brain stores that in its memory bank and dopamine is released and the individual learns to continue to participate in the behavior. You might be asking yourself, what does heroin feel like? Now, the first time somebody uses heroin, that individual will feel a rush from the first hit. They can feel a warm, fuzzy, cozy state. Also, psychologically, they're going to experience escape from physical, mental, emotional pain. And this state can last up to 4 or 5 hours. After continued use, the brain will begin to organize around having a constant flow of the chemical being introduced into the system. So the brain's going to adapt. And what's going to happen is, with the chemicals changing in the brain to tolerate the substance, when you remove the substance, there's going to be a message sent to the central nervous system, which is going to create withdrawal symptoms. Now, withdrawal symptoms, this can be a range of many different things. Nausea, muscle cramps, anxiety, fever, diarrhea, a lot of flu-like symptoms, and then plus the emotional effects of being withheld from the chemicals. Now that you kind of know what heroin feels like, how does somebody get addicted? We are starting to hear a lot of the same narrative over and over again, and this is why there's such a problem now. Usually what we'll hear is somebody's first exposure to opioids, opiates, heroin is going to be pills. So how does this normally start? Maybe somebody gets introduced in the schoolyard, a friend has it. Maybe a teenager or adolescent finds some pills in the medicine cabinet. Oftentimes we'll hear about people just getting injured and they end up in the hospital and they end up with a prescription. And if somebody has the need to escape, they're predisposed for that escapism, once they start to ingest this, they become dependent on it. Physically dependent, but also mentally and emotionally dependent on this substance. So this is how we can see somebody who starts off with like, yeah, I just ended up in the emergency room, to, well, now the doctor's cutting me off, to, well, maybe I'll buy some black market pills, to, what do you mean you're all out of pills? Okay, let's try heroin. And this is the progression that we're hearing time and time again. Oftentimes now we're hearing that it'll progress to fentanyl. And because of fentanyl, the US is seeing a much greater just explosion of overdoses. Fentanyl being much stronger than heroin, and oftentimes the user not even realizing that what they're getting has fentanyl in it. Regardless of whether somebody is smoking, snorting, injecting heroin, what eventually happens is the substance, the heroin, becomes the individual's sole priority. Over time, in that person's brain hierarchy, when it comes to survival, heroin will become the #1 top priority above everything else. And what that means is all of a sudden, where I'm going to sleep tonight, shelter, is no longer a priority. Food, what I'm going to eat, who I associate with. When the brain's perception is the drug is what I need to survive, then everything else will be a far, far second. And this is the all-encompassing disease of addiction. And because of that, we can look for indicators and cues. We can see red flags if somebody's using heroin. So how can I really tell if somebody is using heroin? changes in behavior. For example, a loss of energy, a loss of appetite, memory problems, nodding out while you're talking to somebody, which will consist of somebody pretty much falling asleep while they're standing there or you're having a conversation with them. Tiny, small pupils are usually a pretty good indicator. We can also look at how withdrawal symptoms will affect somebody and also be those indicators that somebody is using heroin. Nervousness, nausea, shakiness, anxiousness are all withdrawal symptoms. We can also look for certain indicators to see how somebody is ingesting heroin. An obvious one is needle marks, track marks, if somebody is an IV user. A real common one is a very dry voice or cough associated with smoking heroin. So what does heroin look like? It can be a brown powder or a white powder. It can also be a brown sticky substance that's referred to as black tar heroin. Some heroin street names are boy, horse, white horse, black tar, brown, smack, dog food, and H. All of these things can let you know that maybe something's up. The life of active addiction comes with a great deal of suffering. Nobody chooses to suffer. That's not the way we were designed. What happens is heroin or any other substance like heroin creates a false sense of safety and security. And over time, the brain is going to organize around this message to the point to where to be away from heroin or the drugs is terrifying. It tells my brain a message that I'm now compromised. My life is threatened. And because of that, somebody who is in active addiction, it's going to make it really difficult for them to ask for help or treatment, because that's the brain trying to survive. But there's hope. There's hope. People do recover from heroin addiction and put their lives back together and put their disease into remission. However, it is a process, and it starts with a medical detox. The withdrawals from heroin can be painful, and it can last up to 10 days. Supervision and support is critical during a heroin detox. Next is a recovery process addressing biological, social, psychological, spiritual needs that the individual now has the opportunity to fulfill. With the detox, the treatment, the growth, what will happen is where somebody will come from a state of suffering and survival, they will now have the best possible outcome at life, enjoying their life, and true happiness in recovery. We can help you with that. If you or anyone you know suffers from heroin addiction or any kind of substance use disorder, we're here to help you. This is Rob Moe at Treehouse Recovery. Please check out some other videos, and again, if you know anybody or you're suffering, let me help you out. Give us a call.